Okay, the best way that I have found to introduce the cardiovascular system and the blood vessels is to follow Ben, a resident red blood cell, from place to place to place as if you were in a car driving from one town to the next. Usually the diagrams that you're going to be seeing in any book are going to show oxygenated blood as red and oxygen poor blood as blue. All blood is going to flow away from the heart, and the deoxygenated blood will flow back towards the heart. And they usually show that as red going away from the heart, blue coming back to the heart. And the easiest way is to use the schematic flow charts, or they call them pipe diagrams here, and to be able to know that you're going from place to place to place. In the body, we just use regional names that are going to be going from one region to the next region. And for the most part, bodies in the appendicular skeleton are going to be bilateral, whereas in the trunk, a lot of them are asymmetrical and often unpaired. So here is the flow chart that I think is the best way to learn it. And you don't have to know it from this, and I'm going to show you other things so that you can see it going from body regions. But right here, where it says the left ventricle of the heart is going to be the left ventricle of the heart. Remember, it's Ben, as he's gone into the heart and left the heart, he has to go through the aortic valve. As he goes through the aortic valve, he is going up the ascending aorta. If you remember back from the heart video that I showed you, the first two branches off of the ascending aorta are the left and right coronary arteries. That's because the heart is selfish. It really wants the most freshly oxygenated blood, and so as Ben goes through the right side of the heart to the lungs and then to the left side of the heart, comes up here, he is then going to go through the coronary arteries and then to the heart muscle. But just to follow Ben as the example, Ben made it through the heart, he went through the aortic valve, he is going up the ascending aorta, and then the next thing that will go there is going to be the aortic arch. The aortic arch always has, in humans, 3 branches. On the right side is going to be the brachiocephalic trunk. On the left side is going to be the left subclavian artery. And then sandwiched in between them is going to be the left common carotid artery. So if you always think of them 1, 2, 3, your middle finger is going to be the left common carotid, and then the left subclavian off of the aortic arch. If Ben didn't go to your head and Ben went around there and then started to go down the descending aorta, it is technically called the thoracic aorta up to the diaphragm, and then Ben, if he went to your lower extremities, would be called the abdominal aorta after the diaphragm as it's going inferior. So that's just the beginning of how it would work. I'm going to do Ben going to the right arm and Ben going to the left arm in a couple different pictures here. Here is what most people would see on a chart. Here is the heart. Here is the ascending aorta, and then off of the arch is going to be brachiocephalic, left common carotid, and left subclavian. They're kind of tiny in this picture. And if Ben went to the head, he'd have to go through one of those branches. But the best way to follow Ben is to go from place to place. So Ben has gone up, down the ascending aortic arch, down the descending aorta, and it's called the thoracic aorta up to the diaphragm, the abdominal aorta until you get down to about the belly button, and then it's going to branch into the right and the left sides, and they are called the common iliac artery. This picture here shows it really well. So from the abdominal aorta, you're going down the right common iliac, and then it's going to change name right here at this little one here, which is called the internal iliac. Then that portion is going to be called the external iliac artery. Then as soon as it goes past this tendon or this ligament that goes from the ASIS to the pubic arch, it now becomes the femoral artery. The femoral artery will then have branches that will go to the head of the femur and then other branches, but we're just going to go over the main branches. So we have the abdominal aorta, the common iliac. It changes names at the internal iliac to the external iliac. Then when it leaves the pelvis, it goes and becomes the femoral artery. And then the femoral artery will go behind the knee. And the reason for that is it doesn't make sense to have an artery on top of your knee. You need to be able to see it behind there. And so if I go from there to another picture, here is the abdominal aorta, here is the common iliac, here is the internal iliac, then it changes names to here, which is the external iliac. Here is this ligament going from ASIS to the pubic tubercle, and then this one here is called the femoral artery. Then you'll kind of notice it disappears because it's going to go behind the knee. And as it does that, so we've gone down the femoral artery, it then goes down into the popliteal region, and behind the kneecap, it's known as the popliteal artery. And then if we follow that, it's going to go behind the tibia, which is called the posterior tibial artery. Obviously, in the lower leg, there's going to be two bones. One of them is going to be the tibia, and the little toe side is going to be the fibula. So it's going to bifurcate there and be known as the fibular artery. And so up here behind or at the popliteal artery, you can see there's a branch that will go to the inside or the anterior portion of this, which I guess is going to be best shown here. And this is called the anterior tibial artery. And then finally, as you get down to the bend at your ankle, the artery that is going to be palpated to do a peripheral pulse check would be the dorsalis pedis artery. So that is on both sides. They're just showing you the right side here, but I'm going to go backwards just so you can kind of see where it is. So from here is the abdominal aorta. Then it's going to branch into the common iliac on the right and the common iliac on the left, which has been cut off. Then it's going to have branches that would go off of that. For example, the internal iliac is the landmark. So this is common up to here, which is going to be internal, and now it becomes the external iliac. Once you get out of the pelvis, you are now going to be called, remember, Ben is just going from place to place to place. It's the femoral artery. They showed here as a light red here, and so it's not in the front, it's going to be behind the kneecap and the popliteal region, which is the bend of your knee, and so it's called the popliteal artery. As it goes down that way and behind the knee here, it's going to follow down as the posterior tibial artery, which would go into the arteries of your sole of your foot. And before that, because you're going to have a branch that needs to go to the fibula, it's called the fibular artery. On the anterior side, which is this one here shown close up, is going to be the anterior tibial artery, which would then go down the tibia itself. And then finally, you would have the bend of your ankle, and that would be called the dorsalis pedis, where you could palpate someone's pulse down there to see if they have a good blood flow, or could Ben get all the way down there. So that's the lower extremities, and they're the same for both the left and the right side. If I go back up to the upper extremities, and let me do it here. So Ben went through the heart. He went through the atrial aortic valve. He went up the ascending aorta. Here is the arch of the aorta. There are three branches off of the arch of the aorta. The first one here on the right is called the brachiocephalic trunk. Then as it goes from here, the brachiocephalic, it goes into, and it may not be labeled here, but it's labeled on the left side. This would be the right subclavian artery. As you get closer here to the armpit, that would be the axillary artery. Then the main branch that goes down the humerus is called the brachial artery. Then it has a chance to bifurcate here. Down the thumb side, it's going to be the radial artery, which will bring you down to the wrist. And on the pinky side, it's called the ulnar artery, which would bring you to the wrist. That's usually all I ever ask is, what is the name of this, that, and the other thing? You can kind of see there are other branches. There is going to be a humeral circumflex artery that would go to the head of the humerus. But all you really need to know at this particular point is brachiocephalic trunk to the right subclavian artery, to the axillary artery, to the brachial artery, to the thumb side would be the radial artery, and the pinky side would be the ulnar side on the right side. So the difference between right versus left is this thing right here. After Ben went through the heart, he's going up the ascending aorta, and he's going to miss the brachiocephalic because he's not going to the right arm. He's going to miss the left common carotid because he's not going to the head. So the next one on this side is going to be the left subclavian artery. There is no left brachiocephalic artery. Let's see if they show this better. Nope, they don't. Okay, so on the left side, you have gone into the left subclavian artery, and then the same thing is going to repeat that you had on the right. Then after the left subclavian, you're going to go to the left axillary artery. Then you're going to go down the arm as the left brachial artery. Then you're going to go towards the thumb side as the left radial artery, or the pinky side as the left ulnar artery. So as I've been putting this together over the years, the easiest way is to follow Ben, because he's our resident red blood cell, as he goes from place to place to place. One of the things, and people have questions about this, can I go from here to here? No, you have to follow the pathway. So if you are driving down the highway, unless you're cutting through everyone's lawn, it's the same thing. Ben can only be in one place at a time. So I've had students ask, well, how do you know which way Ben's going? Well, Ben doesn't have a conscience. He is just going with the flow. So if the flow says go down to the wrist, he's going to follow one of these pathways down there. So although here he could make a decision to go to the right or to the left, it just depends on the lazy river ride of the bloodstream, which way he ends up going. He might have to go to the thumb, he might have to go to the pinky, and then he might have to go to all of the digits. We're just going to ask you at this particular point to know the pathway from Ben being in the heart to Ben going down to the wrist on the right side or the wrist on the left side. Hopefully from what I said, you notice that there is one tributary that is going to be more on the right than on the left, because the left off of the aortic arch is the left subclavian, whereas on the right, it's the right brachiocephalic trunk, which will have, and that's right there, it'll go into the right subclavian, and it will also go into the right common carotid. So there is actually one that goes right into the left common carotid, but on the right side, you got to go into the brachiocephalic trunk, not go up to the head, and just follow it into the subclavian, into the axillary, into the brachial, then to the wrist, either going thumb side or the pinky side. So it isn't that difficult. You just have to make sure that you know the pathway from place to place to place. The return trip is a little bit different, and I'm just going to move ahead so that you can see that. Same thing, I'm going to have the flow chart. So remember, these are flowing back to the heart. So if I take any one of these and you follow the arrow, it's going from the veins of the upper limb, which would be the radial vein or the ulnar vein, which would go into the brachial vein, which would then go into the axillary vein, which would go into the right subclavian vein, and then it would go into the one of the vessels that will go into the right atrium is called the superior vena cava. So off of the right subclavian artery, you go into the right subclavian vein. Remember, there was a right subclavian trunk, and then that will go into the superior vena cava, which will go into the right atrium of the heart. The same thing would happen on the left side. You would go from the left thumb side would be radial vein into the brachial vein, into the axillary vein, into the left subclavian vein. Then you would go into the left brachiocephalic vein, Then you'd go into the superior vena cava, because remember, there's only 3 vessels that will go into the right atrium. Above the diaphragm, it's the superior vena cava. Below the diaphragm is the inferior vena cava, and we'll talk about that in a few seconds. And then the other one is the coronary sinus. Those are the only 3 branches that go into the right atrium. Every place else is going to bring it to some vessel that will bring it back to the right atrium. So I'm just going to go to the lower extremity, and the arteries and the veins follow each other next to each other, with the veins being more superficial and the arteries being deeper. So if we go back to this thing that looks a little more like a person, and Ben somehow made it down to his right ankle, in order to go back, he would have to go through the dorsalis pedis vein, which would bring him into the anterior tibial vein, which would go behind the knee here at the popliteal vein, which would then go into the femoral vein. Then we would get to about here, and we would leave the leg and go into the axillary portion, and then that would be the external iliac vein, which would go to the common iliac vein, which would go to the vessel that's below the diaphragm, which would be called the inferior vena cava. That would bring Ben back to his the right atrium, and then he would have to go through the heart on the left side, go to the lungs, pick up oxygen, go to the right side, and then through the arterial system, go someplace else. Let's assume Ben made it all the way down to the left ankle. In order to go back, he could go the anterior tibial vein, popliteal vein, femoral vein, and then he'd work his way back into the inferior vena cava, back to the right atrium. I like to think of some of these other vessels as a 222 bypass. For those of you who are living in this area, you know, there are roads that are bypassing other roads. So if you think of it right here, this one that goes, I don't want to go up through here and here and here. This one goes from the ankle, and it goes all the way up past the knee, past everything, and it goes into the femoral vein. And that is called the great saphenous vein. And I like to think of that as the 222 bypass, because you're bypassing a whole bunch of structures. And so Ben made it down to the ankle, and so he didn't want to follow the same way back. He wanted to take a shortcut, and so he's going to hop into the great saphenous vein that will go all the way up to the femoral vein, which will go into the external iliac vein, which will go into the common iliac vein on both sides, which would then go into the inferior vena cava. And of course, the inferior vena cava is going to bring Ben back to the right atrium, where he will complete his journey again. Okay? So the lower extremities are pretty straightforward. You go from place to place to place, but you also have this one here, which is the great saphenous vein. There is also one that's called the small saphenous vein that kind of eliminates all of the structures in the lower leg, and you can kind of see it here, and you'll just kind of blend into the femoral vein, which will bring you back. For what you need to know at this particular point, follow the way back to the right atrium the same way you went to wherever you went. The same thing with the extremities, and I'll just go off of this one. Ben went through the left side of the heart, went to the lungs, he picked up oxygen, he went to the left side of the heart. He came in through the right side of the heart. Then he would go up to the ascending aorta, and then he was going to go to either the left arm or the right arm. So as he's going up through there, let's say he got down to the wrist. And so Ben, on this particular side, which is the right side, he got to the wrist. He could then go through the pinky side, which would be the ulnar vein. He would then go from the ulnar vein up here to the brachial vein, and I don't even think that it's listed here. And then from there, you go into the axillary, into the subclavian vein, into the brachiocephalic vein. And the brachiocephalic vein, both on the right and left side, will go into the superior vena cava, which will bring Ben back to the right atrium. The upper extremity also has some 222 bypasses. If you look at some of them here, they show it pretty well. So this one here is kind of on the top of the bicep, and it's called the cephalic vein. So this one here, if you're at the wrist, you can just go past the elbow, go all the way up here, and you can kind of see that blending in somewhere there around the axillary vein. There's also one on the inferior side of it, and it's called the basilic vein. So the basilic vein would go up somewhere to the axillary vein, to the subclavian vein, to the brachiocephalic vein, to the superior vena cava, into the right atrium. So those are some of the ones that we would have to be able to identify on the test on Thursday. Here's a better picture of what we were referring to, a more in-depth, if you want to think of it. Here's the pinky side. Here is the ulnar vein. Here is the basilic vein. That's going to be on the inferior pinky side of that, whereas on the radial side would be the cephalic vein. It goes from somewhere here around the wrist, goes past the elbow, works its way all the way up here, somewhere around the axial or subclavian vein. It will then go into the subclavian vein, into the brachiocephalic vein, which would then go into the superior vena cava. All of the other ones, if you become a doctor, you'll have to know all of them. But for what we're going to ask you to know, it is just going to be very much the larger tributaries. Once again, here is a better view of looking at, so Ben made it down to the ankle, and he could either go the anterior tibial vein, the popliteal vein, the femoral vein, into the external iliac vein, and you can kind of see the internal iliac because that's the end that's going to change it, and the ligament that goes from the ASIS to the pubic tubercle is going to be the inguinal ligament. So it goes from the external iliac vein to the common iliac vein to this vessel here, which is not the abdominal vein. That's the big mistake students make. It is called the inferior vena cava. Then the inferior vena cava will go right into the right atrium. This one here, if you didn't want to go that way, you could just get at the ankle. Ben got dropped off. Remember, Ben can only be in one place at a time, and he can go all the way up the back of the calf, all the way behind the kneecap, miss the popliteal vein, and go all the way up here to the femoral vein, go into the femoral vein, which would then put him into the external iliac vein and the common iliac vein, and then remember, that's going to be the inferior vena cava, which is going to drop Ben back at the right atrium of the heart. So if you think about Ben's life, not that you're going to have to worry about that at all, but a good way to learn this is to think about Ben going from place to place to place. Here is an even better view of looking at it. You can see Ben, maybe he made it down to my big toe. He's dumping off his oxygen here, but he has to take one of these digital veins to a plantar vein. Remember, that's going to be the regional name of the bottom of your foot. And he could go posterior tibial vein or a small saphenous vein if he was into that one. But he has to make it up to the kneecap, and at the back of the kneecap would be the popliteal vein back here. Then he can go up the femoral vein, in which case he has to go into the external iliac vein, into the common iliac vein, into the inferior vena cava, and bring him back up to the right atrium. That is the end of being able to know the major blood vessels of the body. They are going to, if you think of them as a roadmap, you can tell that Ben can only be in one place at a time. And then in order to get to the other place, unless there's a bypass, he has to follow it, and it's usually named regionally. Good.